First of all, I can report there are no new cases of COVID-19 to report in New Zealand today. So our total number of confirmed and probable cases remains at 1,499, and of these, 1,149 are confirmed cases, the number we report to the WHO. No change in the number of people who have recovered from yesterday. That is 1,433, which represents 96% of all confirmed and probable cases. There are just 2 people in hospital again today, one in Middlemore and one in Auckland Hospital, and neither are in intensive care units. The number of significant clusters remains at 16, but obviously no additional cases to add to any of those. And there are no additional deaths to report today. Yesterday there were 2,570 laboratory tests processed, and so our total number to date is 230,718 tests. Tonight I'll be leading the New Zealand delegation at the 2020 World Health Assembly. This is held annually in Geneva, usually over a period of a week. This year, because of the circumstances, it will be undertaken virtually and over sessions over a couple of days. I'm looking forward to hearing from the WHO Director General, Dr. Tedros, on his thoughts for the future efforts around COVID-19 globally, and also about broader global health issues. The Minister of Health, the Honourable Dr. David Clark, will be presenting New Zealand's country statement via video. I don't have a speaking part, even though I'm the head of the delegation, because the interventions by countries will be made very short. However, if there's something that member states speak about that I think it's in New Zealand's interest to intervene on, I will do so. New Zealand is co-sponsoring a resolution on COVID-19. The purpose of the resolution is to agree at a high level the future areas of work to be undertaken on COVID-19 by member states and by the World Health Organization and other organizations. And one example is, for example, to ensure fair access to vaccines as part of the global efforts to develop and make these available. At a time of global crisis around a public health issue, it's critical that countries come together, and the COVID-19 resolution aims to support that. Such solidarity will ensure we respond collectively, as we must do, to these sorts of global challenges. There will also be in the resolution a reference to a review of the pandemic and the response to it. I will note that after any global health emergency or issue, this is done. For example, it has happened with Ebola, and it happened after the swine flu pandemic, H1N1, in 2009. The findings of the reviews help inform both the WHO's subsequent work and the work of member states as well, and ensures that appropriate technical guidance and support is developed. There is general agreement amongst WHO members on the issues outlined in the resolution. There's been a lot of work been undertaken by diplomats over the last few weeks to get to that level of agreement, and it is expected to be adopted unanimously. And finally, I want to talk briefly on church and faith-based gatherings. I know there was some publicity over the last weekend about these. It's important I start by saying there has been fantastic support from churches and other faith-based organisations right through levels 4 and 3 and into alert level 2 across the country, and they've been very supportive and collective in their efforts to protect all New Zealanders. I know that many people, including those of faith, want to move as quickly as possible to increase the size of gatherings. I know how important it is for people to be able to practice their faith together. The policy intent for gatherings is clear in the Alert Level 2 framework, and this includes the current maximum number of people who can gather is currently 10, and this applies to both private and public gatherings, including church and faith-based ones. But this number is one of the very specific issues that is being reconsidered by Cabinet next Monday. Thank you, and I'll hand over to the Commissioner.
Thank you. Kia ora koutou. I want to open by acknowledging the fantastic effort and commitment from New Zealanders as we've moved into Alert Level 2. apart from an expected period of adjustment, New Zealanders have demonstrated that they understand what is expected of them. Overall, in Alert Level 2, the number of breaches are significantly less than Alert Level 3. We're only getting 200 to 350 reports per day, as compared to the 700 to 1,000 we experienced during Alert Level 3. Since Level 2, we've had 983 breaches reported to police, mostly through the 10.5 phone line. About 700 of those were for businesses and 250 related to mass gatherings. A number of the complaints received have related to retail businesses not having contact tracing systems, and it's important to note that contact tracing for customers for retail businesses is not a requirement, although they must contact trace for workers. A large number of reported breaches around retail premises have related to not maintaining correct distancing measures, something which we believe is now settling down. Parties at private premises featured on Friday and Saturday nights, although not at the levels we've seen in prior weekends. And we continue to take an enforcement approach led by education, encouragement and engagement. We have recorded a total of 30 breaches. 29 of those resulted in warnings and 1 prosecution. There has been some commentary about powers of entry available to police, and since we started in Alert Level 2, there has been no entry of premises using those warrantless powers. The powers are narrowed from what has been in place under the previous state of emergency and health orders, and we in our own operational guidelines have required frontline staff to consult with the District Command Centre or our National Command Centre prior to executing a warrantless power of entry. There's an obligation to report to me as the Commissioner as soon as possible, outlining the circumstances, and in relation to Marae, the Marae Committee would also receive such a report. It's important to emphasise it is unlikely those powers need to be used with any frequency.